Hi everyone, welcome to our webinar. We'll get started shortly. You can take a moment to take the poll on your screen and introduce yourself in the chat and questions box, and we'll get started at 2 o'clock. Thank you. Hi everyone, thank you again for joining us today on the Collective Citizenship in Action Peer-to-Peer Community Building webinar presented by Billy Brumage and Bridget Willingson. Maria Restrepo-Toro from the MHTTC will be moderating today's webinar. Before we start, I'd just like to go over a few housekeeping items with you all. Participant microphones are muted, so you can use the chat box where it says chat and questions, or you're currently introducing yourself, to let us know if you have any questions in regards to the topic or if you have any technical difficulties throughout the webinar. Again, if you have any questions about the topic, you can use that chat box. This session is being recorded and it will be available on our MHTTC website within 24 hours of the close of this presentation. Information about CUs and certificates of participation will be after the webinar tomorrow. And if you do have any questions after this session, please email us at newengland@mhttcnetwork.org. And with that, I will hand it off to Maria. Maria, I think you may be muted.
Okay, did you hear anything I said?
No,
okay.
Not yet.
Okay, I'm so sorry. Okay, so good afternoon, everybody. My name is Maria Restrepo-Toro, and I'm an educator at the Yale Program on Recovery and Community Health. I'm also the manager of the New England Mental Health CTC network. We are one of the 10 national mental health CTCs around the country, and it is our honor that you have joined us today for this fantastic presentation this afternoon. Our mental health CTC serves the New England region, which is region number 1, and our project is funded by SAMHSA. Our team consists of us at the Yale Program on Recovery and Community Health, which both of my colleagues will be presenters shortly. And we are doing this project in collaboration with C4 Innovations, the Harvard University Department of Psychiatry, and the Center for Educational Improvement. The mission of the New England Mental Health CTC is to use evidence-based means to disseminate practices across the New England region. So basically, we are a training and technical assistance center and resource for you at the region. We have a specific area of expertise, which is around recovery-oriented practices. That includes recovery support services, all within the context of recovery-oriented care. which clearly this webinar is very important about. One of our missions in our mental health CTC is to ensure inclusion. We want to make sure that our work is responsive for all the different communities that exist around the New England region, and we are invested in really developing and maintaining a variety of government officials, policymakers, system leaders, family members, people with lived experience, all kinds of stakeholders within the New England region. This inclusion is even more important during this time of crisis that we all are living in the country. So feel free to reach out to us. We would love for you to become part of this, and we would love to be able to work with your community. So as I mentioned, our center has the expertise. So as I mentioned before, we are one of the 10 regional centers within the country. We, as Promoting Recovery-Oriented Services, have developed principles that promote resilience and recovery, and you can find those on our website. These principles are really important, and it guides all the activities that we do in the New England Mental Health CTC. We understand that we need to be based recovery. It's always based on respect, and it is emerging from hope. It could be hope from the individual, from the family members, the natural supports. We understand that these practices are family and person-driven, and that we also value and understand that recovery comes in a variety of pathways. It has been our experience that recovery and resilience happens through community and through collaboration, which is exactly what we're going to be talking about today. And that culture is culturally based and influenced. We promote having trauma-informed practices, and we do understand that the individually, the family, and the community strength must be involved at all times. And clearly, our most important person in this process is always the person that is in recovery. So it is my honor to introduce you to my fabulous two colleagues, Billy and Bridget, as I know them. I have the honor to be working with them for 5 years at Yale. Billy is the community organizer at the Yale Program on Recovery and Community Health. He is the co-chair of the Structural Competence Curriculum Committee at the Yale Department of Psychiatry. He is a social worker and has been dedicated his life to work in the community, mental health, and food assistance in the New Haven area. He can definitely tell you a little bit more about himself, and you can see his impressive bio. But I think it's very important that you understand that he's devoted his career to really work in the community with all kinds of stakeholders, and he's coming to do this webinar with a wealth of experience. And our second presenter is Bridget Williamson. She is the co-director of the Citizenship Project in New Haven, Connecticut, also at the Yale Program on Community Health. Bridget is the co-director of the Citizenship Project at our program in the Yale Program on Recovery and Community Health. And she's worked in the field peer support for 11 years. She started as a peer mentor in New Haven and has been at PERCH since 2007. Her contributions around citizens-oriented care and community organizing and peer support are invaluable. So it is my honor to turn it over to our fabulous presenters of the day. Thank you very much.
Thank you, Maria.
Thank you so much, Maria. Really appreciate it. So welcome, everyone. We're thrilled that you could join us. We're really excited to talk about our projects here in New Haven and how we got to them and some of the sort of values that we try to hold as part of our work here. So just to quickly go over what we hope to cover today, fairly simple. We hope to cover the foundations of collective citizenship. So we'll start with, Bridget will talk a little bit in a couple of slides about collective or citizenship, and then how collective citizenship, I'll talk about how that came out of that. And then some ideas for putting collective citizenship into action. So we'll take the theory and talk about some of the things we're doing here in New Haven to hopefully give you some insights into things that you might be able to bring back to your communities. And just to quickly go over our goals for this webinar, we'll, like I said, we're going to review the history and the framework of citizenship and recovering citizenship and collective citizenship, so this sort of evolution of thinking, and they're all kind of mixed in with each other, so we'll talk a little bit about that. We'll describe the group Focus, Act, Connect Every Day, the FACE group, which is sort of our way that we've been doing collective citizenship, or one of the main ways we've been doing it here in New Haven, Connecticut. We'll explain how FACE aligns with and moves into the world, the collective citizenship framework. We'll talk a little bit about FACE in the context of COVID-19 and how we think that it's an important part of people getting what they need socially and having an opportunity to impact community during COVID-19. And then we'll provide a platform, which is one of the most important parts to discuss with you all what you think is important about it. As you'll see, FACE is really something that is about everyone contributing and everyone having a voice, and that no voice is more important than the other. So we really want to make sure that we get all of your input, and as much as you might learn from this presentation, we know we'll also learn from your comments and ideas from work you're doing where you are. And I just want to, before I turn it over to Bridget, just wanted to acknowledge the times we're living in, the tribulation and struggle that a lot of communities are going through right now, particularly communities of color. So we just really want to bring that into the space and make sure that we acknowledge that and acknowledge the suffering that many of you are going through right now. And I'll advance the slide and go to Bridget. Your turn.
Thank you, Bill. Hi again, my name is Bridget, and I'm honored to be on this call. I'm sorry I'm not zooming on the call, but again, we're here to talk about the citizenship background and the overview. So citizenship is basically just supporting people living a full, meaningful life, to me, in the community, which we talk about the 5 R's, the rights, responsibilities, the roles, the resources, and relationships. And the last one is belonging, because I think everybody should feel like they belong to something bigger than themselves. So the Citizen Project has been, the intervention has been around for probably 19 or 20 years now, with the recovery to citizenship through Michael Rowe and Larry Davidson. And the first one, they talk about recovery, talking about living, one's life as best and fully as one can, and full of mental health that won't go away. To me, mental health, I have mental health. I have both. I had the substance abuse and mental health. So when we talk about mental health is only a small proportion of my life. It's not the whole me. When you walk in to meet me or see me, we don't look at people, oh, this person has mental health. We look at the person as a human being. So to me, it's just a small percentage of my pie or my cake. It's not the whole me. And when we're talking about adapting to the environment and still providing support, I want to use this example because I wasn't always getting high. I did go to school. I went to Quinnipiac College, and this is where my drug addiction started. I was a heroin user for 13, 14 straight years, but before I got into heroin, I was going to school. I had a full ride, and when I went to Quinnipiac, I went on a scholarship to play basketball. And what I noticed, I came from an all-black community living in Ashland Street Projects to going into an all-white school where only 4 or 5 black people was there at my freshman year at Quinnipiac. And it wasn't even a university there. And we talking about adapting to an environment. My whole environment was all white. So I had to really change and shift my way of thinking to be around all these white people where I never was at. So fear, risk among the practitioners. So I think when we go and try to seek help or have a case manager, when we go out to try to take risks of just looking for a job or going to move forward into higher education, we find that a lot of people under the healthcare system want to protect us. They don't want us to go out and take risks. And to me, it says a lot about them because of the control that most agencies have, and they fear for people. But we survive in the community out here, so why we can't move forward and surviving and getting a job and getting a higher education? Because I want what everybody else wants. You know, because I have mental health, it shouldn't stop me from having a nice car, a nice house, you know. So I just think the people that's in power have their own biases, and this is why they want to keep people, you know, kind of, you know, stuck. Recovery has paid a lot of attention to the societal conditions with process happens like poverty and race. I became a product of my environment because I lived around all poor people. So did I get affected by that? Yes, because I couldn't see or grow. And to this day, I've been off of food stamps since I've been with Yale. But because it became a culture of me, I had to learn to not live with food stamps, not feel like the food stamps it was mine, because I was only supposed to get assistance for the food stamps until I was able to better myself. So I just think that when we look at people, we just don't look at people under the care of a facility. We want to look at people of holistically, because if my rent ain't paid, if my kid don't got no food in the house, that affects me. Yeah, Billy?
Thanks, Bridget. So really building off what Bridget said and moving on to that fifth sort of point there, that citizenship and recovering citizenship, the idea I think that citizenship has added a lot to recovery is working on this two-path approach that Michael Rowe and Larry Davidson talked about, with the idea that that we both support the person in recovery, but also support the communities in which that person lives, so that being out and active in the community is a role for us as mental health providers and supporters of each individual. So as Bridget was talking about food stamps as an example, that working with communities to address food security and the situations people are facing that also impact their recovery process is something that really needs to be thought of by mental health service providers in a citizenship framework. And then the do it now approach, Bridget also talked about this, really is just to get out there and do it. So it's not necessarily doing a lot of risk assessment and that kind of thing about people entering in community. Larry Davidson talks often about people spending the majority of their lives in community. So people are out there anyways, and part of citizenship is supporting that life in the community, acknowledging that life in the community. Similar to things like a lot of us are familiar with, like housing first, that the first thing is housing, and then we'll figure out the rest, and the same with supported employment. If someone says they want a job, then our work is to find that job and not to dwell too much on the what ifs. And then this last part, which will be part of our sort of leads to our poll question, which you will all see later on, hopefully will stimulate some conversation, is that the systems of care, mental health care specifically, since we're talking about that in this setting, are not really equipped currently to support people's valued roles in the community, that we maybe aren't building as many community networks as we would need to be able to support someone's full life as a member of the community. And then I'll talk about, so we've gone from citizenship, as Bridget talked about, with the 5 R's and belonging of citizenship, which is sort of the foundation of our whole citizenship theory and framework, to the recovering citizenship that we just covered. And then now we're also talking about this collective citizenship. So I think that these papers that you've seen on the slides will be included in the material that you can access later if you're especially interested in digging into the actual papers in a little bit more detail of any of these things. But the collective citizenship is building off sort of recovering citizenship, that it responds to this idea that mental health care tends to focus as its point of contact with the individual, that we really focus on individual recovery, on individual well-being, and that kind of thing, versus something where it might be more the collective well-being and how people are doing collectively on a neighborhood basis or as a collective of people. This next point is very important for us. The way we talk about FACE is that the power rests within the group, and that the power actually comes from inside the group, and that's where it exists, rather than being, rather than us as providers or those of us on the call that are providers, that we possess it and then portion it out to people as we go along. That's important to think about, that the place where power rests is really critical to collective citizenship, that we don't actually have it in the first place, that it really belongs in with the group. And that can be a little bit, controversial, and a little bit different than a lot of what we're doing in a lot of practice. So that's I think, part of the challenge of collective citizenship. But that's not to say that we don't have a role, and I think this is something that Michael Rowe, who is, Bridget had mentioned, as sort of the founder of the citizenship theory and framework that we work on, this idea of common cause partners, that we're not to then say completely necessarily step away as professionals, but that we need to be conscious and aware of what we and how we enter the space and how we operate in the space, that we're partners in this shared cause of community building, of community integration and engagement. And that the shift in power has to happen. It has to be intentional, that social service providers who are used to having power in this sort of staff-client dynamic are thinking about how they're shifting power and putting the power back to community members with lived experience. So I think that's important to think about, that we're not calling it necessarily people with lived experience or people in recovery that have moved on to other things. It's really that this idea that people are community members and have lived experiences of mental illness, but often experiences of poverty, incarceration, and other things, and that the power is shifted intentionally to them when we're talking about community building. And that it's also important to understand that this doesn't replace the individual's personal rights. In fact, it's very important that this supports those rights that people have to be safe, to have decent housing, the basic human rights, that we really try to support those collectively, so that those are all still very much in place. But we add in this sort of idea of mutual support and acting to secure our rights collectively, because we know it's much easier for a group of people to secure rights and to keep and to advance our rights than it is for an individual. So we really espouse that kind of approach. And then Bridget is going to talk about our one of our specific ways of implementing it, the FACE group.
Thank you so much, Bill. Yes, we started in April 2015 at a social club. We just had a general conversation with a small group of us, and we decided to move it out of the clubhouse because I really wanted people to be able to let their hair down, to feel free to talk what they want to talk about, because it's important to hear and validate what people are saying. So we left out the clubhouse intentionally so the power can be shifted, all the people that we started out with, I think it was about like 8 of us we started out, we all had lived experience. So I thought that was very powerful, that we all, had the mental health, and again, some of us were dual diagnosed, so that was attended. So people in recovery, the staff, family members, because I had, I'm the bridge of the FACE group because I am the co-director of the Citizen Project. Once my group ends in 6 months, I usually, get people, ask people would they like to join the FACE group, because it is a community group, and it's still outside of the healthcare system, and I let them know that it's nothing like the Citizen Project. Over at FACE, you're able to be yourself, and everybody is validated there. So my peer role is in recruiting is very important, because I get the people to come there, tell you the truth. So the group is leaderless and decision-making. I think this is why I keep coming, because there's no one in control of the group. As Billy says, that is leaderless, but Billy is the note taker, and Billy is the one with the money, because we do have, snacks. We have a coffee or a cold drink and probably a bagel there. Our last meeting before COVID-19, we was meeting at IKEA, and I thought, you can get a great breakfast for like $2 or $3 for breakfast, and people are showing up. The place is a little long for a lot of people to get there, but they show up. And I think if we were going out, and I was back in that unclean world using, I would go to New York to get stuff. So people showed up. Who has the answer? The group has the answer. The agenda is set by the group. Before we start, we ask if anybody got anything to put on the agenda, so everybody has a voice. That's how we do that. We create space for everyone to be the expert of their own community experience, and we're flexible depending on the situation. We have sat there and met. We meet biweekly, and we meet on Fridays. But if the group, as someone struggling in a group, like we had a young man came in, and I think a family member had passed away, we can take up the whole group just supporting him. So the staff role, a convener, reminder, connected to the community access network, peer support, and sometimes expert, but not the expert. So I think it's like the trainer training the trainer. We don't have the answers. I make sure all the people that I work with, I build relationships, because I just think if I didn't have the relationships with them at the Citizen Project before they enter in the face, I don't know if they will, be willingly to come into face, because one thing they do know, once I build that relationship, I don't lie to none of the people I work with, and I keep it, I tell them the truth. FACE is a safe group. It's not a street group. It's not an AA group. It's not an NA group. It's a very different group, but it's a very powerful group, because you have all lived experience at the table, so who the best to drive their own car is them. The power always shifts back into the individual. Thank you.
Thanks, Bridget. And I think that one thing to add, I was thinking as Bridget was talking, is that part of the role of expert is, part of it's very intentional, that we've said that there is no expert and that power is shared, and that's partially or majority what the group decided as we've gone along. As you saw in an earlier slide, we've been going for about 5 years, and the group has really developed its own culture as we've gone along. But I realized while Bridget was talking that I think an important point is that that no one individual can really fully understand what FACE is, and that's how we've always kind of taken it on. Though we have sort of our own ways of doing things, and people, our agenda tends to be continuous from one meeting to the next, the things that got brought up, especially when we're working on projects, which we'll get into a little bit later. But that no individual can possibly really understand all the way what FACE is. We each bring in our own cultural background, our own perspectives, our own upbringings. And so it's very important to acknowledge that there is no individual that can really define what FACE is. And we'll get a little bit more into that after we do a poll question.
Well said, Bill.
So you can see the poll question there. Maybe I'll read it out since there might be some people on the phone. And the question is, can a collective citizenship initiative like FACE exist within the mental health system? Why or why not? We'll take a few minutes for everyone to chime in with your thoughts, and some of this will also help us build the discussion part at the end. So, and we encourage people to be provocative if you feel inclined to. It'll make the conversation that much more rich. Thank you. Some great comments coming in here. It's going to really lead to a great discussion. So we'll maybe go another maybe 2 minutes or so. So for those that are finishing up, please finish up and submit those. Is great. Okay, thanks again for the contributions, everyone. It's a really good discussion on the chat there. And we'll move on. We'll discuss a lot of that at the end. We've got some notes down for the discussion at the end. Hopefully it'll be a vibrant discussion. And we're going to move on to, Bridget's going to talk a little bit about the second part of FACE, actually what we do in the community.
So, thank you, Bill. So, FACE, what do we do in the community? We begin a partner with assisting initiative rather than starting our own. And I think that's very important because I actually did probably 4 trainings with the People Institute in the Undo Racism training. And one thing I did learn out of that about that gatekeeping and how we enter other people's communities and how we exit other people's communities. So I think it's important for us to, when we go into different communities, because we already know the disparities a lot of the communities have around in New Haven, there also are good stuff that these communities have stuff going on. And so I thought we should just like tap into the good stuff that they're doing already and, you know, partnership with them. So we paid attention to how we enter the community. We rely on community as access. Don't we create resources. And the reason why is that, because if we had went over to West River and wanted to do our own thing in West River, I'm quite sure a lot of the community people wouldn't even even build a relationship with us if we were just trying to do our own thing. We've been working on West River, I think, now 5 years, something like that. Might be 6 years, going on 6 years. And we build that relationship with them, and we, you know, work with them like that. We define our role within that context. We have done murals. It seems like we have probably now, we have done like, it seems like 10 murals within the last 5 years of going into the communities, talking about the stuff that we, you know, that's going on in the community and how can we help. So we did all these community murals. We have been to the Fish to help out packing food. I have been there each year except 1 year. I had surgery and I couldn't lift the stuff, but I show up. You know, we present it regularly at the IRCC symposium. I'm teaching about mental health professionals in line with the power shifting and core witness members of Witness to Hunger. I'm also a member to the Witness to Hunger. But I think it's very important when we're talking about shifting that power, because again, a lot of the clinicians and doctors and the academic people have great insight of what they would like to see with the individuals that they're working with. But who can have a better insight than the person that's going through than my doctor? I am the best person to drive my car, and I need, when I go into a healthcare place, I need someone to listen to what I'm saying, not you putting your will on me or what you think I should have or what you think I should need. Shift that power. It's so important for people to empower themselves. I don't want to walk hand by hand with an individual for the rest of their life. I want the individual to walk by themselves. And if they need me later on in the future or next week or 2 days later, I'll be available as long as the Lord keep me on this earth. But the best person is to motivate themselves, empower themselves. It's mutual, not me got all the control. I'm only in the paid position, but I am a peer mentor at heart. Thank you, Billy.
Yeah, I just to add or emphasize what Bridget's saying about sort of in supporting people in their community life is that really a lot of the neighborhoods and where we're doing community work, like the murals and different things like that Bridget mentioned, were picked because a lot of the members in FACE grew up in the neighborhood, lived in the neighborhood, knew people in the neighborhood. So it's another place where, like we've been talking about, that an important part of this is the shifting in power, is that the providers certainly don't know and certainly don't have the same networks and understanding of some of the neighborhoods that we're working in and some of the neighborhood groups that we're working alongside and that have invited us into their community. So it's also really important to consider that the whole person, in the sense that if someone grew up in a neighborhood or spent a significant amount of time there, they're going to really understand the fabric of that neighborhood. So FACE can then enter in a much more authentic and legitimate way into working with that neighborhood. And we've even had some of our members who have steered us away from certain neighborhoods because of some of the tensions that were currently maybe happening in that neighborhood, and said maybe we'll revisit that at a later time. So I think it really emphasizes the importance of the expertise of each member in their own community experience, and the role of sort of humility and power sharing for those in FACE that are mental health providers. So now, since Bridget and Maria and I all and others on the call work at a research organization that purchased part of research, we thought we'd mention some research that we've done on FACE since it's been happening. So we did now just about 3 years ago, we did 15 interviews with FACE members. Some of the members most of the members were people in recovery. Others were people without any disclosed history of mental health or substance use, and were in provider roles. And some were people in recovery in provider roles. So it was a real combination of everyone that was part of FACE at that time. And we did the interviews, in line fully with our institutional review board and all that kind of thing, and worked with some qualitative researchers to develop questions. And what we really came out with after reviewing the interviews and then doing some focus groups and conversations with FACE members that we collected as we were figuring this out, we really came up with sort of 3 major findings. And I will note, as I see in the participants, we have about another maybe 3 or 4 FACE members on. Well, we're lucky enough to have them on the webinar with us, so hopefully during the discussion they will add to, in the true spirit of FACE and collectivity, we will get some more input on these findings. But so one was the decorating a home together. The idea that it goes back to the idea that no one is the single expert or the single decider of this kind of approach, that everyone brings what they bring. So the idea that that it's a place to feel comfortable, accepted, a place to belong, but also a place to bring your individual self and have that be honored. So the idea of decorating a home of each person brings something or some things that mean something to them, and then collectively we create something together. And I think that's a really important part of FACE. FACE as a bridge that we talked a lot about in the group, and these interviews really revealed as well, was a place to learn about the community, a place to mutually be compelled to act in the community. Some people in FACE are very long time community activists with being involved in all kinds of things. Other people are fairly new to the idea of impacting community and doing community building in the ways that FACE does. So this really creates a venue for shared learning and then for shared support and being a bridge out to the community. And then a lot of people talked about feeling more connected, and a word I really like, being more implicated. So feeling like there was more responsibility to the community, that the community had responsibility to us as FACE members, but also that we have a responsibility back to the community as community members. So that, and one thing I'll really emphasize that a few people talked about is this first bullet point under feeling more connected and implicated, is the idea of having a valuable role to share. So sometimes when we go out and we educate the community at different community events, it might be something like, there's an example of a gentleman who was saying, you know, I was always in a marginalized role as being somebody who experienced homelessness for many years, like decades. But now I'm somebody who has this knowledge and this wisdom that I can share, and I can really emphasize that in a way that really expands someone's understanding of the world, understanding of other people in their community. And so it went from being somebody who felt marginalized by that role as to somebody that felt like they were a teacher, that they really had wisdom to share in that role. And that's something that a few members talked about. And also almost everyone talked about an opportunity to give back, that it's so important to have that opportunity for recovery, for wellness. We've probably all seen during this time of COVID-19 that people are really talking a lot about how giving back and being there for their community is really important. And a lot of people talked about how having this collective space to give back was very important. So I'm going to start this next slide, and then Bridget and I are going to work on it together to talk about, since we're dealing with COVID-19, we thought it would be you know, helpful and important for our conversation here to focus on it a little bit. One is that, you know, this top one about the peer-to-peer relationship. So we're talking about peer in terms of peer support workers, certainly Bridget's role and others in the group, but also about this sort of everyone in Perch being a peer to one another, the reaching out to each other, the relationships that have formed over time. So people that aren't in official peer roles or trained peer roles still have a role as someone that can do a different kind of peer support for fellow members of the group. And that the fact that that the relationships aren't mediated by the service system is really important, because I think that's the way that relationships happen out in the community all the time. So it's really important that those that we're sort of replicating that kind of and supporting that kind of relationship that happens in a planned kind of way. And then one thing that we've noticed during FACE, and I'll mention this, is during COVID in FACE, I mean, is that it was more easily to maintain some of these things. So I know in our local, and I'd be very interested in the discussion to see if any of you have faced similar things, but for us locally in our mental health system, it was very difficult to get virtual groups going. It was really difficult to get support groups going. We had some issues with which technology to use, with confidentiality and different things like that. So it really took up until probably the last week or two to have in our mental health service system to be able to get some of these groups up and going. FACE was able to immediately, within the, you know, I think we canceled a meeting. Perch, where we work, shut down on a Thursday, and so we canceled the FACE meeting for Friday, because we always do in person. But by the following Friday, we had a meeting, and we were talking about our experiences, sharing information about health, sharing our own experiences about how to get through the early days of it, and we've met every day since. So every week, every Friday since. So I think that it's really important to understand that there are ways that these grassroots, very simple kind of interventions are really important when the system is stressed. And I know some people in the chat, and I hope we'll have time to talk about it in the discussion, talked about sort of the stress on systems financially and in terms of staffing and that kind of thing. I think FACE has some really interesting ways to address that kind of thing. Also, I think that FACE is very much oriented to mutual aid, and that we really are, the whole group is about helping each other. And people probably saw in wherever your community is that the kind of mutual aid and helping one another, both in sort of informal and formal ways, really popped up as an incredibly important way to get through COVID-19 in the early days, and now certainly still as unemployment is still going, and mental health stress is increased for almost everybody. So we were able to share community resources and share emotional space to just talk about this and get through as fellow members of FACE. And also that FACE has not been ever focused on mental health treatment. As Bridget mentioned, we do leave space for people. As someone, we've had, like she said, entire sessions where we talked about someone who was going through a loss, someone that was dealing with depression, anyone that was dealing with other kinds of things that were going on in their life related to their mental health or substance use. But it's not specifically focused on that. So I think it was much easier, since we are focused on the community, to look at the whole person of each FACE member as we shifted into a more stressed time in our community due to COVID-19. And we talked also about giving back before, and that FACE has certainly been, a lot of people have talked about during COVID, has been a great way to break up the loneliness or feeling of isolation that people had, particularly when we were asked to not really go outside much at all, and certainly not to see anybody at all. That's been important. And I just want to also touch on is this collective citizenship approach. Our partnership with Witnesses to Hunger, which Bridget mentioned earlier, is an anti-hunger activist organization, also led by people with lived experience of hunger and food insecurity. And that we partnered with them thinking that a lot of our community work is related to community building, a lot of like community fairs and working with neighborhood organizations and things like that. And some members of FACE want to be more involved in working on more political type things, more like systems change things that have to do with policy and political change. And I think it's going to be particularly important, obviously, now coming out of COVID-19 and some of the other situations we're facing right now, that there's an avenue for doing this. So, not all FACE members either want to be part of political work. So we wanted to not make FACE necessarily political, because that's not what the group wanted to do, or at least overtly political. But having a place where a lot of our members, and I'll sort of segue to Bridget here, that a lot of similar to FACE, a lot of the people that join Witnesses, Bridget provided the trust and the trusting relationship to say, hey, why don't you try this out? These people are cool, and these people are sort of in line with us. And now Witnesses to Hunger, probably out of the 30 or 40 members of Witnesses, probably almost half are FACE members. So it's been a great bridge into this additional community asset. So I'll leave that with you, Bridget, if you have more comments about what we've been doing during COVID.
Oh, my phone was on mute. I'm sorry. The work don't stop because it's COVID-19. We had a young man out here living in the Elks that was homeless, been shot. Father put him out, did time, and he was literally here for like a month and a half, where my sister and my sisters, we gave him comforters, food, washcloths, like deodorant. We gave him everything he would need to survive out there at that Elks Club. And not only that, well, I tell you the truth, I went and got some drug dealers that I knew, and put them up, gave money up to put him in a hotel because there was too much thunder and lightning out there, and he's in a wheelchair. So because it's COVID-19, my peer work don't stop. You know what I mean? So I'm still giving back, even with Yale saying that we can't work, but my community is suffering. People don't have food. They still don't got masses. I got people next door don't have masses. So, you know, I'm going to do what I can because that's what I do. I just like to treat people like human beings. When we have cancer, when people on dialysis, we don't go walk up to them and say, hey, you got cancer, hey, you got dialysis. We call them by their name. And this is what our faith group is about. It's just treating people like human beings, saying good morning, opening the door. I even go in my pocket and buy anybody something to drink if it's needed. So I love faith, and I love Witness to Home, and I love my job. And I appreciate you guys letting me do this presentation with you. Thank you so much.
And so we're going to move into the discussion and sort of questions part. If anyone has specific questions, I know maybe some of the sort of nuts and bolts of FACE, we were trying to sort of cover the whole picture, but if anybody has any questions about the specific nuts and bolts of how FACE works, how it's funded, how, you know, that kind of thing, we'd be glad to also answer those kind of questions in the discussion. I know Maria is going to help us moderate this part, so thank you, Maria. Okay, so.
Maria, you may be on mute.
Okay, thank you again. I do this. Okay, great, excellent. So Billy and Bridget, thank you so much. We have so many interesting points and questions, and I know some of you had a chance to answer, and I think, Billy, you've been answered this. As you were describing this process, it was really striking to me how the importance of highlighting the values, and I'm wondering, you know, highlighting the values such as this is the relationship, the beauty of this group, somebody said on the chat, is really about grassroots organizations. It's not mediated by the mental health system. And it's really, the role is very important, helping people find roles. So maybe that's a good place to start in terms of that. There is a question as well around how one addresses the willingness of the mental health system. There were several points regarding funding. And I think because Bridget announced that you somehow find funding, I think people are also curious as to how you do that. Yes. But maybe that's a good place to start. So I was just kind of summarizing and connecting those back to the values of the mental health ETC, but I think the mental health system and funding came up a few times. So I'm wondering if you have some comments about that.
Yeah, so I saw that Megan in Washington, nice to see someone from all the way across the country, it had a question about that kind of thing about nuts and bolts and funding. So,
exactly.
And so I think that, I guess I'll start that in terms of funding, like Bridget mentioned, that I come with the money for coffee, really the funding for FACE has really primarily been the allocation of a couple hours a week for my time and Bridget's time, and then a few other people that are part of Perch have also dropped in on the group from time to time. I think there's some on the call with us today as well. But really that's been the bulk of the funding has been for that. We don't have any overhead really in terms of, like, we don't have any vehicles related to it. We always meet downtown. So for people or somewhere on the bus line, we now meet at the IKEA because they have cheap breakfast. But we basically, the funding is primarily that, and then the rest of our funding is related to, we provide breakfast. So the reason we go to IKEA is it's about a $3 or $4 breakfast. So It runs, somewhere in the $50 every 2 weeks range, which I know is a lot generally, but not that much in terms of program budgets. And then the other cost, that's really it. I mean, we printed some T-shirts. We probably every 2 years or so we print T-shirts for new members. So we have enough T-shirts for when we go out into community events so that we can be identified as a group. That's something that the group decided a while ago, that we should have T-shirts. So that's really the main funding. We don't provide any kind of stipend. We don't provide any kind of like transportation, although I could see certainly in more rural settings that might be certainly a consideration for how to get people there. Or in situations that might, in urban settings, it might also make sense to provide like bus passes or that kind of thing. We do always meet somewhere that's right on the bus line. A lot of our members, or majority of our members, don't have vehicles. And so we meet on the bus line. Almost all of our community events are on the bus line, so that people can get themselves there. But people that have members that have cars have also given rides to people along the way. So I should just say that our funding is really, it's just a willingness to support those people. And I would particularly say that someone in Bridget's role, to have somebody that's a peer support worker that also is strong in the community and has strong ties in the community is critical to sort of keeping the whole thing together and making sure people know what's going on and making sure we're meeting and that kind of thing. Any more on that part, Bridget? I don't want
You said it well. You said it well, Bill.
Billy, there is a question in how does one become a FACE member and what is the initial process of engaging?
Okay. Do you want to take that, Bridget?
Yeah, I keep moving my thing. I'm sorry. Yeah, Maria, all you have to do is show up. Just show up there. We don't turn nobody away. The door is the open door policy there. I'm sorry, I just came outside because it just got kind of warm in the house. So that's why I keep muting you. But anyone can come there, as long as you're 18 years. Well, actually, my grandson is 11 years old. My grandson, when now school out, when we was meeting, he'll show up. And he's a young activist. So anyone can come there, baby. You don't need no referral or nothing like that. The only thing that we ask when people do come is that, remember, we have one mic, which means we want one person to speak at a time. Because people are passionate about what they're talking about and their experience, you can have everybody at the table gibbling, right? We don't want that. We want one person speaking, and we all want to listen and to support the individual, and that comes from the relationship building.
So this is part of, I think, and there might be some other questions, so I'll defer back to Maria, but I think this is sort of underlying sort of origin of the poll question is we don't officially exist within a mental health treatment setting. FACE is its own sort of thing, its own entity existing out in the world outside of any kind of mental health system. So that was, I think, underlying part of the question, and then I'll go back to Maria for other questions that we have.
Something in terms of education for providers, and do you find that you need to educate providers around this to embrace the model?
I would say that we haven't really done any provider training, and that partially that's because we exist outside of, like I said, the mental health system. So really it's mostly been providing sort of outreach and then really education within the group for each other about what this group is about and how we want it to move forward. I think that probably provider education mostly happens from people that are part of FACE, going back maybe and talking, if they do have a provider, talking to their provider about what FACE is. But to this point, because like Bridget said, there are no referrals or anything, you just show up. You just hear about it and you show up. that there hasn't really been much of a push to do provider education other than what Bridget pointed out in one of the slides about what FACE does. We have been invited to present at conferences. We've been part of the International Recovery and Citizenship Collective, I think C stands for, conferences and really been presenting, including to like our commissioner of our mental health authority in Connecticut was at one of our meetings. Also we've presented to the ISPS US at their conference. We were invited by now somebody that's now a current FACE member, thankfully, to present there. So we've actually done a lot of presenting and provider education, but it's been at a different level versus them in their sort of direct staff role through the mental health center. It's been more about sort of presenting these new ideas, these kind of innovative ways to do citizenship and recovery, and having it sort of filtered down that way.
Great, thank you. And I think if you're interested, I know we've been hearing the words recovery, citizenship a lot. On our website, there is a fabulous video. There is a lot of articles that are referring, and you can definitely go and visit us and download those, and you will learn a little bit more about the model. I think another question early on was about the barriers to embrace FACE, to establish FACE groups. You did address some. I don't know if Bridget had want to comment on other things.
I don't understand the question, Maria, you asking, babe.
Somebody asked if are there any barriers to embrace FACE, to do it in the community?
Nah, there's no barriers. We already been living with barriers with our own experience, right? So when we go at the table with FACE, we just bring our true selves there. And I'm not going to tell you each time that I show up at FACE that I'm smiling and it's a good day, right? Because every day is different, every minute is different, every second is different because I am in recovery. But here, especially with this COVID-19, it really it boosts my anxiety higher. So I need FACE more than any group at this point right now. In how we get to meet every Friday, because I enter the meeting on the phone, and I had missed a Friday because of some other personal stuff that was going on. So when I entered back that following Friday, and they was talking, and I was out the loop because I had missed that previous Friday, and just asked, listen, I'm struggling. I don't know how to say it. I know we meet bi-weekly, and now we're doing this thing. This is all new because to keep my recovery was tight. When I mean by tight, I have my recovery under control. And now that this COVID-19 is around, my anxiety's up, my craving is up. So I needed people. I needed to talk to people. Instead of me bombarding everyone that I have in my circle, I asked the group, is it possible that we can meet, instead of meeting bi-weekly on this phone, can we meet weekly? And this is how we was able to do it because, Maria, I was struggling. And, I'm a kind of pretty much strong woman, but at that time I was really weak. And with FACE meeting every Friday and giving me the forum, the floor to be able to share what I was going through, it helped me get back to where I'm at today. And I have less anxiety today, to answer the question.
Thank you, Bridget. Hear you loud and clear. You have the only thing is to show up. Billy?
Yeah, so I just, to add, I think Bridget really said it all, but I think that, in terms of, becoming a member and engagement, I think Bridget really talked about it, but just to emphasize that kind of the openness of it, I know we're very used to this idea of referrals and things like that, and FACE is really, is open, but when people come in, it's not a matter of just, just do whatever you want. I mean, it is in a sense that it's very open, and FACE is sort of intentionally not determined what we are and what we do, but there is a sort of introduction, and one of our members that's on the line often takes on that responsibility, that when a new member comes in, when somebody's there for the first time, whether it be a new member that Bridget's recruited from the Citizens Project, or somebody else knew, a friend of a friend. People have brought people that they've met in 12-step groups to FACE, or people have certainly brought romantic partners, or one time we had a young man that just somehow heard about us that wasn't part of the mental health system and joined us for about a couple of months until he moved out of town. So really, when anyone comes in, that person is introduced to what we do, but also with the idea that FACE is really, we're not defining it as this is all we can do or all we are, but with the idea of here's some of our traditions, here's some of the things we've developed over 5 years. So it kind of answers, I know someone had a question when we were doing the poll about leaderless nature of it. So leaderless is really the way that we consider like the power in the group, that there isn't anyone that actually has power to decide what FACE will or won't do. All our decisions are made by consensus, which for those who have done consensus, it can be a very painful process just in terms of, or not painful, stressful process, because it really, it's one person can disagree with something, and then you have to go back a step to where that disagreement came in. But we find through that's the best way that we've been able to do things. So, for example, we don't have a leader, but we all agree that we make decisions by consensus, or there's certain ways that we approach our community work that we've learned over years that aren't necessarily defined in any way. They're not codified anywhere, but they are part of what we do. So in a way, the groups and the traditions have taken on the leader role. And then there are some very sort of light things that happen, like Bridget really is a leader in a lot of ways in terms of recruiting people and inviting people into the group. And I've often taken the role of, or I have taken the role as being the note taker. So that's something that just like somebody that gathers the agenda items, not necessarily puts a thumb on the scale of what will be on the agenda, but just making sure the agenda is taken, and that if we get towards the end of the meeting and an agenda item hasn't come up, to say, should we talk about this now, or should we table this for the next meeting, and then somebody can remember that at the next meeting we had tabled this, we want to talk about it. So in that way, we, as a group, we've talked about it a lot, and don't consider those to be sort of positions with greater power, really, but more of positions that we need to kind of just keep the group functioning at this point now, week to week, but usually on a bi-weekly basis.
Thank you, Billy. I think there are a few to answer. I think some of it has to do with, you talk a little bit about creative ways to meet in places where food is free. So Jonathan was asking how to increase free meals, free shelter, especially for people who are homeless in recovery. They were asking also about COVID-19. During this time, have you been meeting virtually, just to meet the requirements of social distancing? And Brad is also asking about, how do you guys make decisions? Rank choice, how do you decide what to do?
You want to take any of those, Bridget?
Yeah, I'm just going to say this one with the decision making. So I'd say we probably took 3 months, 4 months, maybe 6 months to talk about the T-shirts. So we got on the conversation about the T-shirts. We've been talking about these T-shirts. We keep coming back to the T-shirts, table it, come back. So I jumped up. I had to use the bathroom. The group was, talkative, and I came out the bathroom, and we had 5 minutes left of the group, and I said, I came out to Bridget, we made a decision on the shirts. I was like, okay, what's the color? They told me the color. I was like, what? So I thought about it a quick minute, and I said, I have to say this, that I don't mean to blow up nobody's spot, but I just don't see myself, because I picture myself in this shirt, walking around in the community, and I just couldn't see myself wearing that shirt. And after we took all this time to get down the color we want, what we want, once I came out the bathroom, I shook the whole conversation, and I said, listen, I don't feel comfortable with this shirt. So we had to go back, Marie, and revisit the shirts again until we all came to the conclusion or what shirt we're going to wear. Though nothing gets passed and safe without every member agreeing. This is what keeps me. Sorry, I talked too much. I'm sorry.
No, it's perfect. So you are involved and you take as long as you need.
Yeah.
Brad is asking, what did you write on the t-shirt?
That's a good question, Brad. We have an artist in our group that helped us design it, but basically what Bridget's talking about is our decision making of, it took us, many, many months to decide, and what we ended up with was sort of this like design of words, these 7 words that have kind of become our unofficial logo, things like human, dignity, respect, words that we spent months and months, like Bridget talked about, talking about because we went out in the community. We wanted to represent ourselves, and we wanted to have it be representative of all of us. And I know Maria had mentioned something like ranked choice voting, which would make things probably easier, but the way the group sort of came up with it was to do this consensus, and just a really like true consensus of just the way Bridget described it was beautiful, and it happens all the time. That's exactly how we have done it. So the shirt is, I can maybe find a way to share it, I'm not sure, but it's basically 7 words, some of them I mentioned, that the group came up collectively. We started with 20 words, and the same thing with FACE. Our group's called Focus, Act, Connect Every Day, and that took several months to figure out exactly what our group was going to be called and that kind of thing. So that was, it's just an example of how the group moves, and it's not for everyone, but I would say we've only had a few members that have really had a problem with the way that the consensus works, maybe just from not having the sense of patience for how long it might take. We've also had members, we had a member that was with us for a while that came in and was new and said, kind of said, this is taking too long, and kind of had some suggestions for how we might move forward still using a consensus process, and that really helped as well. So it's just one example of all the kind of ways that people can contribute to that. And I should mention, too, something that Bridget's really good at that she didn't mention is this idea of asking people who are not speaking up, to say, would you like to say anything? So we really have that part of our process, that if we've gotten through a part of a meeting and there's been somebody that hasn't said much, it's just acknowledging that person. That's also part of the tradition. So nobody has to say anything if they don't want to. They can just be there. But there's also an invitation to speak and an acknowledgement of those that might have quieter voices, might for some reason or another be less likely to speak up in a group, just to make sure that everyone has the opportunity to speak. And and those kind of things are also built on trust, so that people don't feel like all of a sudden the spotlight is turned on them. It's more of an opportunity to contribute, basically.
Thank you both. So I think, do you have did you do any changes in terms of the COVID-19 for the social distancing?
Yeah, we've been meeting virtually. We've been meeting using Zoom. And the beauty of that has been that a number of our members don't have either a way to get online or like a data plan that would allow for a lot of time online. So the good thing about Zoom has been that people can call in and also have their Zoom in if they want, like video in if they want to. So that's been really helpful. And I have to say that it's been interesting with FACE because we, unlike a lot of meetings I've been on, I'll just note this, is most of the time, most of the mics aren't muted, and somehow because of our relationship and the way we've done things over time, there really isn't a lot of interruption, going back to the way that Bridget mentioned the one mic. So I think there is this kind of sense of like, that balance that people have found in the group, that our members have found, of sort of respecting each other's voice and that kind of thing. Not to say that that doesn't happen in other Zoom meetings. I just noticed that it's sort of more of a conversational thing, and it doesn't feel like a meeting. It feels more like a FACE get-together like we're used to having. I don't know if you want to add, Bridget. You've been on pretty much all the Zooms.
Excellent. So I think regarding of the homeless question, and based on what you guys have said earlier, it sounds like everybody, as long as they want to come, because Bridget explained earlier on that the mental illness is just only a tiny aspect of all this process. So it's not like you particularly do something different. I mean, everybody's welcome. There's a great suggestion in terms of, getting free Panera. It sounds like, if you're not looking at the chat, it says that some Paneras, at least in Boston and maybe other locations around the country, offer the option that you pay as much as you can. So I guess that goes to the earlier question as, like, how do we get free resources and food for people? If we need to. Clearly, each community is going to be different.
Mm-hmm.
But I don't know if you wish to respond to anything raised before.
I mean, I can just mention on both of those things that the Panera suggestion is great. I mean, in terms of sort of if there weren't the resources like we have to pay for the coffee every other week and that kind of thing, that a pay-as-you-can kind of thing where people are gathering anyway over a cup of coffee or whatever they can get. And we actually did meet in the Panera in downtown New Haven for a couple of years until we sort of outgrew it, and we had people standing around the table and that kind of thing. And so that's another reason why we moved to IKEA. But in terms of the resources, and I'll just say quickly and then let Bridget add in, is that I think on the food side of things, we, through Witnesses to Hunger, which, like I said, a lot of the FACE members, but not everybody has joined, Bridget and I included have joined it, we work with, so we've been able to work through a lot of coalitions and existing groups that are working on food security locally, from things like free grocery delivery during COVID to changing policy locally on how people access food, to increasing like grocery delivery services right now, all kinds of different things that Witnesses to Hunger has been working on. So it's not, unfortunately, it's not a direct answer to exactly how to find resources, but I think the fact that we've added members and added voices, and particularly voices of people that are experiencing some of the struggles with not having enough food, has really helped our community here in New Haven. So our role has been really working in coalition with people around that issue. You have stuff to add, Bridget?
Yeah, also, Billy, a lot of the people that's homeless, they come in with their own agendas. They already know a lot of the stuff. It's like the experts I was saying, the training the trainers. A lot of people that's homeless are resilient. They know how to survive. They know where the resources at. So it's not so much that I have to say or we have to say. A lot of them already know it. But again, it's just that little shift that they need, or a little push, or taking that risk. And I always let them know they're not alone, because what they are going through, I have been through it a lot of times because I'm a little older than them. So my experience, I can share it because I have been there. And I'm going to fight the fight with them. We together, it's like we together, yeah.
And I see a comment by Brad that, that it just makes me think we have helped also with mutual aid. The group has also helped each other through things. We had a member that was about to lose his housing. He was an older veteran. And the group really rallied. There was one of the members was part of his tenant board. Another member offered to help fill out the application with him. So there is that piece too of, direct help, or to go with someone to see their case manager to help sort of make sure things get moved along properly. So that part also exists, on a more a smaller collective way that members work on with each other.
The support.
Yep.
Excellent. Any other questions? I don't see any further questions at this point. It's clearly that SPACE is really about supporting people through whatever they're going through, and really what people really, and I think as Bridget said, it's about the trust and belonging, and it's just supporting people, and because it's not like any other support group out there. It's really is for the people, with the people, and it's a collective group that's being led between everybody present. I don't know if there are any other questions. If not, I can turn it over to, or any final thoughts from either of you before we turn it over to Vanessa.
Thank you all for all the great questions. That's it really was a great conversation. So thank you.
Hi, everyone. I do want to echo Billy and Bridget. Thank you for joining us today on this webinar. We do have upcoming events on our website. If you'd like to register for any of these events, you can just click on the link on your screen. That will take you to the website. But we'll also follow up with an email tomorrow to all of the registrants that will include a link to their website, the recording link for this webinar, PowerPoint, and any other resources that Billy and Bridget discussed today. And then if you want, you can always follow us on social media. We do share webinars and products on our social media as well as our website. And then you can always contact Billy and Bridget if you do have any other questions after this webinar. Again, this information will be available to you via email when we send it out tomorrow to all of the registrants. And again, thank you everyone for joining us. If you can stay in the room until we end the webinar, you'll receive a survey about today's event. If you could please take a moment to fill it out. It would be great to have you fill it out so we can continue to provide these wonderful events led by Billy and Bridget and all of the other wonderful presenters that we work with. Thank you.
Thank you.
Thank you so much, everybody.